one of the critical pieces is, if I incorporate ocular surface disease management in my practice at a really high level, and then I purchase a widget, maybe it's an IPL or RF or low-level light therapy or tear care, whatever the thing is, and I recommend it, I believe in it, I build a process so that I know exactly when I'm going to use that in addition to all the other things that I'm going to take care of for a patient. I know all those things, and I recommend it. And let's say it's $1,000 treatment, and the patient walks out the door and says, I'm not paying for that. And the doctor looks at the schedule and says, did Johnny schedule for his IPL? No, he didn't schedule for his IPL. Oh, well, what did I do wrong? We try again on Susie. Susie, you recommend it for Susie, and you're really confident. You've got your words down, and Susie doesn't schedule for the IPL. And then Jenny comes by, and same thing. You look at your schedule, and at the end of the day, you look at it and said, I talked to 3 patients about IPL today, and none of them scheduled. That's what we're trying to prepare you for. It's constant thinking for the next quarter, goal setting for this pillar. Hello and welcome to the Crystal Podcast on iCode Media. Today I'm going to go through step 5 of building your pillar. We call this Comprehensive Optometry Simplified. This is the last part of Comprehensive Optometry Simplified, where we actually help you integrate protocols into your practice. This is a ton of fun because we make it custom for you. One of the biggest challenges that a lot of people have integrating new protocols is that they listen to how another expert might do it and they say, I can't do that in my practice. I don't have the beliefs that it's going to work for me. So we work with that. We work with you to make that protocol work in your practice. The way I do things in my practice, the standards I have in my practice are different than yours. I mean, what I mean by that is the things we do in routine in our practice is different. We might do some more things. Some people might do other things more than we do as far as screening and as far as how much time we're taking on pre-testing, how much time we're spending with patients is always different. So what we're trying to do in this piece in creating your pillar is saying, listen, I know I can follow a clinical practice guideline based on what the AOA says or the American Academy of Ophthalmology's preferred practice patterns say. But if I have to do all these things in order to adhere to a standard of care, so if we think about glaucoma patients, and we've used that as an example before, if I'm supposed to do gonioscopy and an optic nerve OCT and visual field at some interval based on that recommendation, that's kind of the baseline. Well, I got to figure out how I'm going to do that in my practice. Well, Chris might do it one way, and Kyle might do it another way, but and another expert might do it another way. But I always think, well, that's not how I practice. So the whole goal of these last 5 steps that we've gone through over the last couple months is to say, how do we get this into your practice, the way it works for you, the way you talk, the way you deliver information to your patients. And so step 5, I call plan to fail. And before we get into step 5, remember that step 1 is what are the questions we need based on intake forms. Step 2 is what is the process that I'm going to follow in my practice. We've already talked about that. Step 3 is what information am I going to need to provide for the patient so that they understand what's going on, whether it's digital or physical or communication. How am I talking to the patient? Step 4 is understanding the value that this service brings to the practice so that we can remove the uncertainty about whether our practice will be profitable and just take care of the patient. Now, step 5 is planning to fail. So I hope you enjoy this monologue. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. Step 5 in building a pillar is really important. We can't overlook it. This will fail. Every process you set up will fail. You have to plan for it. If you don't plan for it and it fails, you will revert back to the old things you were doing, I promise you. This is the hardest thing to do, is to change behaviors in practice. It's why we look at surveys that show that 75 or 77% of optometrists over the last year have purchased a new piece of equipment and do not use that piece of equipment in their practice. It is sitting in a closet, and that's what we want to avoid. And so step 5 tells us, listen, if I decide and invest my time and resources into doing this thing, how do I know it's going to work? When a patient pushes back on, why do I need to come back for an ocular surface evaluation? Or why should I come back in 6 months to evaluate my macular degeneration? Or, I have a high deductible, or I have and somebody doesn't follow the instructions that the doctor gives. I mean, this is probably one of the critical pieces is, if I incorporate ocular surface disease management in my practice at a really high level, and then I purchase a widget, maybe it's an IPL or RF or low-level light therapy or tear care, whatever the thing is, and I recommend it, I believe in it, I build a process so that I know exactly when I'm going to use that in addition to all the other things that I'm going to take care of for a patient. I know all those things, and I recommend it. And let's say it's $1,000 treatment, and the patient walks out the door and says, I'm not paying for that. And the doctor looks at the schedule and says, did Johnny schedule for his IPL? No, he didn't schedule for his IPL. Oh, well, what did I do wrong? We try again on Susie. Susie, you recommend it for Susie, and you're really confident. You've got your words down, and Susie doesn't schedule for the IPL. And then Jenny comes by, and same thing. She looks at you, look at your schedule, and at the end of the day, you look at it and said, I talked to 3 patients about IPL today, and none of them scheduled. That's what we're trying to prepare you for. It's constant thinking for the next quarter, goal setting for this pillar. So it will fail. Johnny and Jenny and Susie are all going to come in, and they're probably going to come in at the same day, and they are going to not elect to follow your guidance. And part of what we do within COS, especially in our mastermind sessions, is prepare you for that, have conversations about that, and then help you understand that maybe it's just not time for Susie. Maybe it's that Susie you need to figure out a way to have another connection point with Susie. Maybe part of your communication is, Susie, I want you to take this home and read about it. Step 1 is we're going to schedule you back to do this. But let's say Susie doesn't schedule back. Maybe our process needs to be amended so that if Susie doesn't schedule back, she's coming back in 2 months to reevaluate to make sure that things aren't worse. Or maybe it's 3 months. I don't know what it is for your practice, but the point is that you have to plan to fail. And that means, how are you going to train your staff? That means, what touch points are you going to have with your staff? So first thing in step 5 is, what training does your team need to know that the new services that you're offering or refining exists to the patient. CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. We've been partnering with EssilorLuxottica 360 for a while now, and it helps us in 3 areas. First, they use social media campaigns to highlight products that we believe in and prescribe to our patients, and they deliver those patients back to our practice. Second, EssilorLuxottica 360 enhances our patient experience through staff training tools that help us simplify and streamline the way we communicate about our products and services. Lastly, but for my practice most importantly, it helps us make good business decisions related to our optical offerings. We will systematically and objectively analyze what our patients are purchasing and what they like, and removing products that our patients are not really using or not really drawn to. This, along with additional rebates and immediate savings, helps us continue to deliver high-quality products and services to our patients and keeps our practice resilient. Check out EssilorLuxottica 360 for yourself by visiting EssilorLuxottica360.com. So take glaucoma. What do we need to talk to a patient about glaucoma and why we were seeing them back every year and now we're seeing them back every 6 months because their condition is advanced, perhaps. Or they're a new patient and nobody's ever talked to them about glaucoma risk before, but now you're finding it. How are we going to integrate that in the practice? What do we need to teach our people about glaucoma? What do we need to teach them about copays and deductibles and medical insurance? And what happens if a copay isn't met? That's important. So you've got to know what you're going to train your team. How often are you going to meet? The next thing you think about is how often are we going to be meeting about this? You know, in our practice, we try to do daily huddles. And when I say we try, we are not perfect. We try to, but we aim for daily huddles. We hit them about if we look at the day, it's probably 80% of the time we hit our daily huddles. We also do weekly, and those huddles are really focused. They're about 5 minutes, and all they are is small refinements, preparing for the day to say, oh, Dr. Wolfe, we've got a lot of ocular surface disease evaluations along with glaucoma evaluations stacked back to back. This is going to be a little pain point. So we got to make sure we're not getting bogged down. Who's going to take care of this? Who's going to take care of that, etc. So, and we're going to talk about it. So maybe it's even going over if you've broken down your goals, your metrics, your KPIs into saying, listen, one of the things that we're going to look at is how we're doing on anterior seg images for patients with dry eye evaluation. And our goal was to do, let's say, 10 ocular surface evaluations in a month. And Dr. Wolfe is in, it probably needs to be more than that, but let's say it's 20 in a month, and Dr. Wolfe is in clinic 10 days a week, all right, or 10 days a month. So that means that his goal now is 2 ocular surface evaluations every day on average. So how did we look yesterday? How many ocular surface evaluations did we do? How many anterior segment photos did we bill for myopography, for example? So you can actually track it. That's going to be the focus of that one daily huddle. So you're just primarily focused on those goals and refining the process and figuring out where things might go wrong in the day. The weekly meeting will be a little bit longer. In our practice, again, you don't have to do a weekly meeting, but in our practice, we do a 30-minute weekly meeting. We find that these are helpful because now we can talk about like, okay, we're seeing this trend. How do we communicate about this with the patients? When a patient has a question about this, what has worked well? What hasn't worked well? When patients have pushback on copays or they're concerned about copays, what do we tell them? What if they don't have insurance? How do we handle that? That's a little bit more some time for us to discuss some of the how-tos, some of the role playing. Hey, Chris Wolfe, this is me. I'm talking to my staff. This is what I've been saying to patients when I pull the slit lamp away and I'm talking about glaucoma. Are there any ways that you think I could do that better? Listen to me. This is what it sounds like. Mrs. Smith, great news. I've got a new prescription for you, a new glasses prescription for you. But one of the things I'm concerned about is, do you see here on these images, your optic nerve looks really suspicious for glaucoma because of these 3 things. And so our clinical practice guidelines recommend that I follow up with you in 6 months to do a deeper evaluation to make sure that you are not having damage or losing vision from the things I'm seeing here. Or maybe it's 3 months, or maybe it's 1 month. And then I ask my staff, how does that sound? Is there something that sounds awkward about it? Am I presenting this in a weird way that makes people uncomfortable? And now, of course, your staff has to be comfortable telling you that, but is there a way that's just a way to get feedback immediately? And then, so that might be the weekly meeting. And then the monthly or the quarterly meeting is when you actually go through all 5 steps again. We're going to refine this. Hey, we're not hitting our goals, so we need to refine a little bit more. Or, hey, we've hit our goals. So this quarter, we're going to dive into the next pillar. Maybe we were working on glaucoma for the last quarter. It is locked down. All our KPIs, all our medical KPIs related to glaucoma, which is visual field per refraction, optic nerve OCT per refraction, gonioscopy per refraction. We are hitting the goal that we set. Now we're going to move on. Or we see room for expansion or enhancement. Now we're going to refocus on these goals again for the next 90 days. Okay, so that's how are we going to train? How are we going to reinforce the messaging that we have? What metrics, we've talked about these before, but what metrics are you going to use to know that your pillar is working? Again, that's why we come back to the KPIs. Within Comprehensive Optometry Simplified, we spend a lot of time talking about those medical KPIs so that you can track them over time. You can track them every week, every day, every month, every quarter to know if the time we're investing in this is worthwhile. Again, and we're going to reflect on that. And then we have to be able to think about, okay, other pitfalls along the way, and how are we going to overcome those pitfalls? So I like to think about this as a pre-mortem, but you're thinking, all right, well, on purpose, we're going to put down on paper, if this doesn't work, why isn't it going to work? Is it because we haven't collected copays? Is it because we haven't articulated the problems to the patient well, and et cetera? And if we anticipate those pitfalls, then we can make plans so that we can overcome those pitfalls. So that is step 5. I hope that was helpful for everybody. This is a ton of fun for me to go through, and it's a lot of fun to customize this for the practices we work with. I hope it was helpful for you. I will see you on the next one.
Hey, if you enjoyed this episode, make sure to subscribe to us on Apple Podcasts and our YouTube channel, both linked in the show notes. Now, here's something exciting. We're giving away a 1-year subscription to Comprehensive Optometry Simplified. All you have to do is leave us a review on Apple Podcasts, take a screenshot, and email it to me at questions@icodeeducation.com. We'll put that in the show notes as well. We'll be selecting a winner on December 15th, so don't miss your chance to get access to this valuable resource. Thanks again for listening. I can't wait to see your reviews.